Hello students, we will discuss a condition. Just see what the condition this one is. See that what is this condition. You can see here there is ulcer here, probably partly grafted, but remaining area is protruding outside. Red it is. So it's naturally granulation tissue, all of you know. Granulation tissue is pink, pulseful and very active, painless. So, but it's protruding out. That is not normal. You know that granulation tissue contains new capillaries, fibroblast, all those content with a thin lining. So very friable is a granulation tissue. So it may form pyogenic granulomas which when localized with the infection, or it may become other types, other forms also. It may be healthy, it may be non-healthy, although different classifications are there for granulation tissue. Now one of the type is this one. Now this is called as, all of you know, it is exuberant granulation tissue. So it is granulation tissue which is proliferating or protruding more than normal. So that is often difficult to manage because it prevents the epithelialization, bleeds and often may get infected. It prevents the skin cover. It prevents the wound closure. So that is the problem with the exuberant granulation. It's a very typical, see that? Look at this, very typical exuberant granulation tissue. So it occurs in a chronic ulcer. It also can occur in a sinus where a sinus doesn't have floor, whereas a ulcer has got a floor. There is a differentiation. And so because of the angiogenesis, why this hyperangiogenesis? There is more angiogenesis than normal and more fibroblast proliferation. That is the reason why this exuberant granulation tissue occurs. So it prevents the epithelial coverage and into the raw area. So it needs to be excised and to create a proper bed for healing on its own by wound contracture and scarring or by skin grafting. So it needs to be excised, shaved off, or rather shaved off, so that it creates a proper bed for a new epithelialization and or to place skin grafting. So it has to be addressed properly. This is called as exuberant granulation tissue with more angiogenesis and fibroblast proliferation. So students, I hope this is about the granulation tissue with a short note, different types I have told. We can always go through my clinical methods in surgery and manual of surgery and surgical excisions. You can go through my operative surgery and suturing technique atlas also there with the video. And you can go through my beginner video lecture through JP to learn everything about surgery, operative procedures, specialties and so on through JP publishers. So students, I hope you understood this interesting topic, exuberant granulation tissue very well. Thank you very much.